Okay, people often who have never seen a pelvic physio will ask me what to expect at their first appointment. This is a very important question. You should know what you're going in for. A pelvic floor initial consult would be a thorough examination of your physical, functional, and emotional aspects of health. We are going to talk about how your range of motion is, if you have any specific symptoms, how your general medical history is, what your fitness history is, and what are the main symptoms you're coming in for. Also, the assessment will include an internal exam. This is the part that helps us assess what the pelvic floor muscles are doing. Usually the internal exam is through a vaginal entrance, and we check the muscle tone, muscle strength, and muscle coordination. Now, the only accurate way of checking a pelvic floor muscle function is either via vaginal ultrasound or by a digital palpation. Because we don't have the transvaginal ultrasounds in all the clinics, we use digital palpations to confirm our findings. Although that is a very critical part of your examination, it's done completely under your consent, and a pelvic floor physiotherapist will explain to you completely about what that examination entails. After screening through all the contraindications, if you still are not comfortable, then we don't have to go through the internal exam right away. You have full authority to tell them to not have an internal exam at all. It's just a critical component of pelvic floor assessment to tell exactly what the muscles are doing, because they're on the inside of your body, so it's hard to tell what they're doing from the outside. After the assessment, the physiotherapist will explain to you what the findings are. She will explain to you what the treatment techniques would be, and what the plan of treatment would be, and how to expect progress in the next few sessions that you would visit your pelvic floor physiotherapist. So be sure to ask all the questions that you have when you go for your initial consult, so that you're familiar with what's going on with the physiotherapy treatment.